Hello everyone and welcome to another episode of Ask Dr. Bob. Some very interesting questions in regard to a full spectrum of body signals. Somebody wrote a question and wanted to know about a degenerative disc in their neck. They are having chiropractic care, but they wanted to know if they may need to have surgery. Well, I can tell you from my experience, and I've been practicing as a chiropractor and a natural health doctor since 1978, that most chronic disc problems, usually the fifth cervical, which is the middle of the neck, actually results from challenges from the upper part of the mid-back or the thoracic spine. Those vertebrae can literally get stuck. In our practice, we have a video x-ray unit, video spinal fluoroscopy. We do have people that visit us from around the United States where we can put you under the video fluoro and see exactly where your problem is at. So lower part of the cervical spine. Here's the first time that we had a question from a gentleman in reference to a fissured tongue that they had since they were a child. I have deep cracks in my tongue. It never really scared me, but it was a benign condition. That's what he was talking about. And he has read about Chinese medicine with different organs impacting the body. I want you to know that we tend to have improvement with a lot of the mouth lesions with B vitamins. Cracks in the corner of your mouth, vitamin B2. The size of your lips also are impacted by B vitamins. I just know that if you consume sugar, for example, that can take B vitamins out of your body. So my number one goal would be to improve your B vitamins. You want a whole food B vitamin. I may suggest that you may want to contact us and have a test done called Organics Basic of your urine. What we would do is we would assess via a lab the way that your body processes carbohydrates, and oftentimes we see areas of a B vitamin need. If you cry easy, if you have sore muscles after exercise, usually a body signal of B vitamins. We had an individual who contacted us from India with a child that basically comes down to a lot of diarrhea, pretty much no matter what they do. They use a variety of foods, including Nestle's and powdered milks and vegetables and dulse. I would look to see if there's a dairy challenge, number one, because dairy can cause a lot of loose stools, or parasite. Now, we have seen many individuals have parasite issues when they go to third world countries and they drink water where they cook food or consume food that's not been cooked properly. Grinding teeth is a body signal of parasites. Someone wrote us a very interesting question, which is very common. It looks to me that it may have come from Italy in reference to heart palpitations with exercise. What I would encourage you to do is minerals. We use Celtic sea salt. A lot of times you see heart challenges with a need for magnesium. You may consider a multiple mineral. We use multi-mins, Celtic sea salt, and B vitamins. So it's minerals, 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 and B vitamins. Kale is also a great source of magnesium. Dr. Bob, I have a child who's on your ADHD program and always feels hungry. Now, two things I would like to focus on here. One could be, once again, parasites. That's right. Parasites could make you want to eat, and oftentimes lack of minerals. Sometimes we'll see a parotid tissue challenge, maybe due to the measles, mumps, and rubella. I would have an assessment for parasites first, and we can do that with an essential fatty. We can do that with a CBC and a differential. Avocados and walnuts are a great food to get into a person for them not to want to eat because it's a fat and it's slow metabolism. Last question. Somebody wanted to know about cleaning with vinegar and it bothers their sinuses. I would backtrack and tell you this. I would avoid dairy and peanut butter and gluten. Those tend to make your sinuses more sensitive and could be one of the reasons that the vinegar, which is a little bit pungent, could be bothering your sinuses. Drink more water. My name is Dr. Bob Diarrhea.